Hi, okay, this is the new case for today. 40 years old female, breathing difficulty for 2 months and joint pain for 1 year, and the patient's name is Mrs. Smith.
Mrs. Smith, when do you have, no, when did you start have difficult breathing?
Yeah, breathing difficulty,
difficulty.
Yeah, that's like almost a couple of months ago.
Couple months ago.
Yeah.
How did it start?
You know, I'm not very active because of my joint pain, but you know, it just comes and goes on its own. I really don't know what I'm doing to get that problem. It can happen day, night, anytime.
So you just tell me you have breathing difficulty even at night.
Oh yeah, yeah.
When you sleep.
Yeah, and it certainly is getting worse.
And getting worse.
Yeah.
Can you tell me a little bit more about night difficulty breathing? Do you need put several pillows or elevate your head during at night in order to breathe better?
You know, I don't think really any of this thing helps me. I tried because somebody told me, you know, put pillow, this thing. I tried, but it didn't work.
Didn't work. Sorry to hear that. Do you have problems with your breathing at rest?
Breathing at
like
rest?
Do you have breathing difficulty at rest?
Yeah, it can be anytime.
Or
Yeah.
when?
Yeah,
Anytime.
it can be rest, it can be activity, yeah.
Okay. When you walk, do you have even worse breathing difficulty? Do you need to stop to get the breath?
Yeah, I think I get easily tired. I can't do much. I can't do much, you know.
Do you have any chest pain?
Yeah, it's not really pain, it is just tight in back of my chest, yes.
When do you have chest pain or tightness of your chest? When?
It
When
can
you
be
have same time?
it can be there for hours and I'm not even doing much.
So you can have chest tightness anytime, and is associated with breathing difficulty, right?
Yes.
Do you have any cough?
No.
No cough. Okay. What does make it better?
You mean your breathing? There is really not much I can do. I take some,
Yes.
you know, I went to one time to talk to my other doctor, and then he said that if it doesn't get better, go to the hospital. I didn't go anywhere, but, you know, I really don't know even how it happens. It just comes, and then it's been a challenge for the last 2 months.
Does anything make it worse?
Yeah, I'm just weak, you know, I can't do much. I get tired easily.
Do you feel sometimes heart palpitation?
Heart palpitation? Yeah, maybe a few times here there, but nothing significant. Nothing that got my attention so much.
Any dizziness?
Yes, I get dizzy also, yes.
Have you passed out?
No.
Any fever?
No.
Night sweats?
No.
Any rush?
No.
Okay. Any swelling in your legs?
No. And I have swelling in my joints here there sometimes, but not in my legs, no.
Where do you have joint pain? Do you have
Oh,
joint
which
pain?
joints are paining me? It is both sides. It is in my hands, in my fingers, in my wrist, in my knees. They're all hurting.
Does it happen like the pain is getting like is it worse in the morning?
It is worse in the morning. Yeah, it is worse in the morning.
Yeah.
Yeah.
Stiffness in the morning?
It is.
Any stiffness in the
There
morning?
is a stiffness in the morning. Yes.
Stiffness in the morning. Okay. Any redness in your joints?
Any joints are red? No, they are not red. No, they are swollen most of the time.
How long do you have stiffness in the morning? For how long?
Hour or so. About a couple of hours to warm up.
Maybe when you walk, it's getting better, right?
Gradually, but overall, there is always some pain there, you know, but a little bit easing up. But I can't do much.
Problem for one. Sorry, interrupted.
Yeah.
And you have this problem for 1 year.
1 year, yeah.
I asked you before about rash, but have you noticed any rash on your face?
No.
No. All right. Any other medical problems which you like to discuss right now? Any other issues?
No.
My another question to you: do you have any change in your urine habits?
No problem with urination. No.
No problem with your urination. Any change in color of your urine?
No.
What any other medical problems do you have?
Really, I don't have anything else.
You don't have any medication?
They put me on some diclofenac and a little bit of steroid, but that's all what I got. I don't have insurance. They said there are other medications. I couldn't afford it.
Okay, steroids. How long do you use that steroid?
They gave it to me for a few months. Then, you know, I felt a little bit angry and agitated and those things. Then they stopped the steroid.
So you don't use steroids. You use for a couple months.
Yeah.
Is that correct?
Yeah.
Have you noticed any change in your weight?
No.
No change in your weight.
Yeah.
I would like to also ask about your family history.
Yeah, everybody is doing fine. There is no problem in the family.
Can I ask you your occupation?
I don't work.
What did you do before?
I really never had a job.
Have you smoked? Have you ever smoked?
No.
Mrs. Smith, can you summarize what you told me? You told me you have fatigue, breathing difficulty for last 2 months. It happened gradually, right? You told me gradually and getting worse right now.
Yep.
Also, you feel fatigue.
Yeah.
And you told me you have joint pain from 1 year.
Yeah.
And you have stiffness in the morning. So, also, you told me you have sometimes tightness in your chest.
Yeah.
And you feel dizzy, sometimes heart palpitation you feel.
That's true.
Is it correct?
Imagine. Okay. Imagine if the exam you are doing exam and these are the findings in the exam. These are the findings.
Mm-hmm.
At 45 degree, these are the positive findings. At 45 degree, you can see my neck veins Okay, they are
And
prominent.
you see an jugular vein, right?
Yeah,
Extension.
you can see my neck veins, and they have chest is clear. The heart is regular, and but my heart sound is muffled. Is muffled means not very clear to you. And I mean abdomen and GU is normal. Joints, the affected joints are having effusion, and they are tender at movement. What is the next step?
Do you have dizziness when you try to stand up suddenly?
No, no.
Miss Smith, based on your history and physical exam,
Yeah,
I suspect you might have heart problems.
yeah.
And I need to see make picture of your heart. I will also see order EKG to see waves of your heart, and I will order echoes.
You do what?
Echocardiogram to
Oh,
see picture of your
oh,
heart.
echo. Okay, yeah, echo. Yeah. What
Yeah.
else?
Also, I'm going to order chest X-ray to see if have any fusions in your lungs or any problems in your lungs.
Mm-hmm. Okay, this is a chest X-ray right now.
I see the cardiomegaly.
Since you don't know it is heart or something else, you should call it enlarged cardiac silhouette. You can call it cardiomegaly. You can call it enlarged cardiac silhouette. You just saw a big shadow of the heart.
Can we see echo?
Yeah, echo. Okay, you want to do echo. Now let me show you what echo showed here. You see at the top it says effusion. Okay, that is, first of all, it is a subcostal view. They put the probe under your xiphoid. Normally what you see there is liver. Yeah, when you use the subcostal view and you see that much of fluid, then you already know your patient has pericardial effusion. Okay, and patient has a lot of pericardial effusion. Okay, now you have a person who has joint pain, symmetric, both sides for 1 year, and then also has this breathing problem with this fluid here. Now the cardiologist calls you and tells you, okay, this echo, there is no other problem there except the pericardial effusion, and it is a massive pericardial effusion. Now, what other question can you ask the cardiologist to see how bad is the situation?
I am afraid tamponade.
What can he tell you to tell you if there was possibly a tamponade or not? Look at that echo again. You see there is right atrium and then there is right ventricle, yes?
Yeah, right.
Okay, when you have normal heart, when it wants to pump, during diastole, these two both, they get blood in it. Okay, they get blood in it. Means blood goes to right atrium and blood goes to right ventricle. They fill up. When there is pressure outside, instead of this right ventricle and right atrium, they get filled. They stay empty. They in fact collapse. This is why you hear something called right ventricular collapse. Its reflection in blood pressure is called pulsus paradoxus. Pulsus paradoxus. What is that? Okay, you have a systolic blood pressure, yes?
Yeah.
Okay. If your systolic blood pressure during inhalation and exhalation, the change only should be around 10 millimeter. Yeah. Here, when you have tamponade, the difference between this systolic blood pressure in inhalation and exhalation is 20 or more. Okay, means you are measuring the actually blood pressure when you hear the first beats and you know you got your systolic. Then you tell the patient, okay, now breathe deeply. When patient takes a deep breath, normally the difference it should only drop by around 10. Like for example, you hear it at 120 first, yes, you tell the patient take a deep breath. Then what happens is that it should go, instead of 120 it should go to, for example, you can hear it at around 110. Now if instead of 110 you have to go even lower to 100 or lower to hear that systolic, then you know the difference is around 20 or more. That's the way you can measure it. Okay. Now, if you do EKG, what you see in EKG, in fact, what you see is the PR section. PR section, it drops, and then you can have ST elevation. You can have that, but the other thing you can see is in fact called the whole QRS becomes smaller. But then there is something else. This is called pulsus alternans. Okay, now at least we know she has massive pericardial effusion, and it is not tamponade yet. Patient's blood pressure is stable. I mean, systolic blood pressure is around like 125, and you can say that your pulsus paradoxicus is around 15. It is not too high. Okay. Now, what do you think the patient has for, as long as the joint are concerned? The symmetric.
Rheumatoid arthritis.
Okay.
I think in lupus too, you can have.
Yeah, I send you the at least 3. You can have that. You can have lupus. You can have Lyme disease, and all of those things. Okay.
How about sarcoidosis?
Yeah, you can have sarcoidosis too. But yeah, these are all in differential diagnosis. Okay. When you ask, for example, these questions about breathing problem, yeah, that is good. You ask with exercise, is it hard or not? You ask with COPD, you think about pneumonia and other things. Is it acute? Is it chronic? I mean, when did it happen? You ask all those good questions. Yeah. And then, for example, when you see that none of them really gives you a good hint, then really history is stopping there, because there is not more you can get from history. Then you do exam and see what exam shows you. And if exam also they tell you there is nothing there or there is something there, then based on that, and then you think about other things. One of the things is that in real life, you always want to ask the patient, have you gone to any clinic? Have you gone to any doctor for this current problem? Because sometimes they don't tell you. But when you ask them, say, oh yeah, I went to 5 other doctors. And they did my echo. Everything was fine. They did this. Everything was fine. But this is a typical case of rheumatoid arthritis. When they get cardiac involvement, the most common thing, in fact, is pericardial involvement. If you do randomly echo in them, 30% of them, they have pericardial effusion. But tamponade and those things are really not common, maybe less than few percent. And this person was one of them.